What I'm going to do is I'm going to give you some high-level outcomes of the campaign, so to speak, and then really move into what my foundation is working on 100% now. It's called Building a Culture of Health. There's many people involved in this, and so let me get started. And if any of you are tweeters in here, you can see that you can tweet at Sue Hassmiller, include me, or at Campaign for Action. And I would like to give a special acknowledgement to Carolyn, who is one of our public health nurse leaders, Robert Wood Johnson public health nurse leaders, and Stacy, I think I saw your head, Stacy, who is one of our Robert Wood Johnson Foundation Future of Nursing Scholars. So welcome to everyone. So I think for this slide, I could just say, this is what it looks like, right? This is what it looks like. I think in our country, there are pockets, I would call, of things that are working in our country. And my foundation in particular, and so many around the country, are trying to determine where those pockets are that are so successful with getting people to a greater state of health and healthcare in this country, and really trying to bring that in to our system. I hope that the real bedrocks of the Affordable Care Act, we all know that things are sort of being looked at, being undone and redone, and the Affordable Care Act. But I certainly hope that those really major components that included prevention, I have to believe that's going to go on, right? Please say that's going to go on. Prevention, coordinated care, increased, we have increased access, and I hope everyone still gets to retain their coverage. Better population health, lower costs, and improved quality. I think everybody's heads are around value. No matter the administration that just finished, the Obama administration, and this new administration, we are looking for what we can do in regard to a lower cost and a higher value. I know that people's heads are still around that, so we just have to move that agenda in the right way and make sure that as many people as possible can retain that coverage. That's really important. I will say that Robert Wood Johnson Foundation is a nonpartisan organization, which means that we don't take sides, Republican or Democrat, but what we do is we do a lot of research on evidence, and we take a stand on issues. We take big stands on issues, so we know the evidence is that if people have insurance and they have access to a great provider, whether that provider is a physician or a nurse practitioner or advanced practice nurse, we know that the likelihood that they will get better care is there. So we do, as a foundation, really promote that. So Pat just talked to you about the Institute of Medicine report. I would think that everyone knows that we have this report now. It was really back in 2008 when I went to the Institute of Medicine and got to be the study director for this report, unprecedented. Usually the Institute of Medicine, they have their process, and it's a good process, and it's lock solid, and it's like we're in the closet for a time so that we can hear the evidence and aren't swayed by opinion one way or another. It's like our administration special counsel that's going on now. It should be nonpartisan and non-swayable. So it was at that time, if you recall, in 2008 and 2010, when we were working on the report, when all of the debates were going back and forth on Capitol Hill around the Affordable Care Act. And Donna Shalala, who we were so fortunate to have as the chair of this committee, really, the longest serving Secretary for Health and Human Services ever. She served in the Clinton administration. She really understood the healthcare system backwards and forwards. So to have her come in, we knew it was going to be a study on the future of nursing. We certainly did know that, but we didn't start there. And it's really important that we don't start with nursing, because we have to start with, what does our health and healthcare system look like? What are the good things that are going on, those pockets of best practices, and where are our challenges? And that's where we started as a committee. And then we sort of backed into, how could nurses then most effectively be a part of the solutions as we identified them in the report. So it offered recommendations for how nurses might be part of this transformation. And even though the report came out in 2010, you feel it, right? We are still undergoing a transformation in this country. Do you feel it? Yes, the answer is yes, I feel it. So nurses, and I'm going to say that throughout the entire thing, if you don't remember any details of my presentation today, I hope you will at least feel the importance that I am placing on nurses being leaders in this transformation. That is like key and central, and you can retweet that. And all of the roles, and as we go along in this transformation, there are so many roles and so many ways for nurses to be involved. And I love talking to any nursing students. I know we have our Future of Nursing Scholars, but any undergraduate, I love talking to undergraduate nursing students in particular, because it's so wide open these days for nurses, isn't it? They just have no idea, and it's so exciting. I have never swayed from my opinion in my entire career. I always wanted to be a nurse, and I'm always, every day of my life, am glad that I have chosen this profession, because there are just so many opportunities for us, isn't it? So I told you earlier that we didn't start with nursing, and it's so critical to remember that. And so when the report came out in 2010, according to my president at the time, Risa Lavisa-Moray, who was a physician, who said to me, we cannot afford to let this report sit on a shelf. And it hasn't. I'm so thrilled that at the Institute of Medicine, now the National Academies of Sciences, this has been the #1 report every single month, and then they calculate all their month stuff, and then they have a book of the year. This report has been the book of the year every single year since it came out. And that's amazing, given that we are talking about the Institute of Medicine and National Academies of Sciences. So we are thrilled about this, and thrilled that as well, this report is the #1 reason why people go to the NAS website. That's a big deal when people are tracking social media. It's a very big deal. So then when the report came out, we wanted to continue with the notion that this report is about the health of the nation. Okay? This report is about the health of the nation. And as a means to an end, by the way, we think nurses are going to be really great leaders in helping to transform this country's health and healthcare system. So here's the vision, that everyone in America can live a healthier life, supported by a system in which nurses are essential partners in providing care and promoting health. And that's what this campaign has always been about. And we've had, when the report came out, there were 43 recommendations. I'm not going to go through all 43 recommendations. I hope that in order, you know how I want to give you a hint. You know how the IOM report gets to remain the most visited spot on the NAS website? It's when people go to it. So that's a hint. So I'm going to tell you, if you haven't seen the report, you don't have to read the whole thing, but go to the website. It'll get counted. Go to the website, and just look at the summaries and the recommendation areas so you get a feel for where this started and how relevant this has remained to this date in the areas of education, practice and care, leadership, diversity, and interprofessional collaboration. So I'm just going to go over some high-level areas of the report and now the campaign. So, I think the biggest thing out of the gate, honestly, for most people in this country was the 80-20 recommendation. People just sort of resonated with that all over the country. They started gearing up. They've always wanted to work on getting more nurses to a baccalaureate degree. And by the way, I should say that just because the Robert Wood Johnson Foundation and this is in the way. And there we go. I think I'm speaking into this one. Yeah. Okay. Now I forget So since the campaign, we know that just because we have a blueprint now from the Future of Nursing report, everyone in this room, I hope, knows. Everyone is not like a kid in this room. I'm looking around, right? So we have all been working on all of these issues, the American Nurses Association, all the state affiliates, right? NLN, AACN, schools of nursing, employer organization. Everybody has been working on these issues for a very long time. But it took the IOM to come together to really present a blueprint to bring all of this together, right? So the 80-20 recommendation, getting people to a baccalaureate degree, I'm proud to say that in the first time in the history of forever, did you get that? For the first time in the history of forever, we now have more baccalaureate nurses in this country than associate degree nurses. Isn't that great? That is fabulous. And I'm an associate degree nurse. So, and have climbed that ladder. I'm not a very good sympathetic ear, I will tell you. When people come up to me and say, oh, but I don't know if I can go on. I know, I completely know. Listen, I had it too. Money issues, family issues. I did all of this with family. So I'm not like really super sympathetic. I understand, but I want everybody to go on. So that's happening, and that is happening. That has happened on the backs of schools of nursing and employers in this organization, making policies, increasing class sizes. That jump is enormous. It is like the tail wagging its dog, because we do have a lot of associate degree programs in this country, right? Anybody here representing the associate degree? Yeah, so we still have a lot of associate degree programs, and I am so appreciative. I think associate degree programs are doing so much to move their students on these days, and I'm so proud of where I started and what you're doing with the associate degree students. So that's going on. The other thing we're working on, you'll hear more about it when we're talking about how we need to build a culture of health and well-being in this country. And if we are going to be doing that, then we need to be paying attention to the curriculum. And those of you who are in faculty are going, oh gosh, stay away from my curriculum. I have so much in there now. Do not tell me what more I need in my curriculum. Well, I am, sorry. But you'll see that if we're going to be paying attention to the things that keep people well and healthy in this country, it's really not, and I'll say it again, it's really not having like a great doctor or a great nurse practitioner or the fanciest fountain in the hospital lobby. Those are not the things that keep us healthy and well in this country, so stay tuned. So here we are, removing barriers to access and care. Yay for Maryland, right? You have gotten your legislation passed in the state. You have full practice authority. That is so fabulous. There are 22 states in this country now where, this is how I like to say it, where nurse practitioners get to practice what they learned in school. Isn't that like amazing that people pay all this money and go to school and they actually get to do what they learned in school? But still, in the vast majority of our states, nurse practitioners and other advanced practitioners don't get to practice what they learned in school. So thank goodness, this is where AARP comes in. They are our partner on this campaign. That is where the operations headquarters is at AARP, because we wanted to keep this consumer focused. It was really, really important, as I said, that this campaign be about the people and consumers, and that's why AARP is so critical. And this particular pillar area is where they have just stepped way up, and I'm so proud of them, because Robert Wood Johnson Foundation, because we are a private foundation, cannot be involved in lobbying or getting involved in legislative affairs, but you know, AARP can. And boy, do they have power. They're one of the biggest, I don't like to use biggest guns. I don't like guns, I don't like that word. So I'll just say they're one of the most powerful organizations, biggest lobbying, with the biggest lobbying force in Washington, D.C. And they are helping states and continue to help states in getting their legislation passed as part of this campaign. One of the things that I really love what we're doing is because of the new administration and the conservative stance that is going on in our country right now. We are now holding 2 big meetings. We just held one in Dallas, and we'll hold another one towards the end of the year as well. But it's around conservative winning strategies. And so we're bringing states together, our action coalitions, who still need to pass their legislation around scope of practice, and bringing them in with speakers such as Pete Jeffries, who is Director of Campaigns for AARP and really knows how to talk conservative language. And there is a way to talk about this so that it's a win-win for everyone. And I really believe that getting legislation passed around scope of practice is not a partisan issue. This is really a nonpartisan issue. Everyone should be concerned with it. If you want to talk about value, remember how I said that I think this administration, I hope, will pay attention to value-based care as well. This is, you don't get more value-based than advanced practice nurse practitioners. We're really happy at the end of last year that the Veterans Administration chose, after massive amounts of comments, historical amount of comments on both sides, both for allowing the Veterans Administration to have all their advanced practice nurses practice to the top of their education and training in all VA facilities, no matter what state they belong in. So there are a lot of for and against, and we know that in the end, because of the very strong anesthesiology lobby, that the VA chose to allow all APRNs except certified nurse anesthetists to practice to the top of their education and training. So we hope the nurse anesthetists can come along. So leadership, always been very important. This is one of those things that we've all been working on forever, even before the IOM report came out or the campaign. Mentoring is so important, and ensuring that the next generation and people with a voice around very important issues be heard. It's really surprising to me the number of committees and boards and everything where important policies are being made and there are no nurses on that committee. It struck me as Donna Shalala, I told you, she was the chair of our committee, and we were in session one day over at the Institute of Medicine building, And we were at the point where we were talking about the chapters and what would the chapters look like and what, the recommendations and polishing them up and everything, and wondering if we should have leadership as an individual chapter or weaving it through, those typical conversations that generally happen around leadership and diversity, right? Should have their own or should we weave it through? And Donna Shalala came back from Capitol Hill one day, and as I said, this was during the debates around the Affordable Care Act, and she came back and she was just shaking her head. I get it now, I get it. She said that there was a special council called, so there were testimony being presented on this particular day to the House and the Senate around how to best deliver care in this country. And she said there were physicians who spoke, there were pharmaceutical representatives, there were a couple of healthcare administrators, policy people, and she said, it just dawned on me, we were talking about how best to deliver care in this country, and there was no nurse, not one nurse to be found anywhere. And she said, we've got to make a big deal about this, and we have. And since that time of trying to convince everyone that more nurses need to be on committees and boards, then our foundation, Robert Wood Johnson, gave a grant to the American Nurses Foundation to start its own Nurses on Boards coalition to make sure and ensure that we get more nurses on board. If you have a chance, I really want to, here's another website where we're counting things and it really matters. So I really want you to not do it now, but take this down, nursesonboardscoalition.org, nursesonboardscoalition.org. And if you are on a board or a committee, I want you to go to that website and be counted, because we really want to know where nurses are serving all over the country. We're trying, our big attempts are to get nurses serving on boards and committees that are not nursing related. I expect me and you to be a part of your professional associations, your state nursing associations, your specialty nursing associations, but to be a part of other, healthy Maryland. You don't say Marylanders, do you? Healthy Maryland, but when it's plural, okay, anyway. The people who are on committees to keep Maryland healthy, healthy kids or healthy whatever, you would be surprised at how many coalitions there are to get people healthy. It has the word healthy in it, and there are no nurses on those commissions. You would be surprised. There are a lot of different public health people and different kinds of people, but people really want to hear from nurses. You have your own leadership development program here that is really great. I said earlier to Pat that the action coalitions, we have 51 action coalitions all over the country, and they may be known for like one thing. They may have glommed on to the 80-20 recommendation or leadership. A lot of them are working on diversity, but I will tell you, Maryland has it going on. They really have activities going in leadership, diversity, interprofessional, workforce. I'm so proud of this particular action coalition. This is, the Maryland Action Coalition could speak to this more than I could, but from what I understand, you have 40 people who are in a leadership development program every year, and they get special training on leadership development, mentoring, and here's the brochure. I think everybody has this brochure in their packet. Yeah, so you can read more about that. I don't know exactly how you get in, but someone like Pat could help with that. But it's just tremendous. A lot of our action coalitions have what they call 40 under 40, where they're bringing in really emerging, diverse leaders, and this is probably something similar, but not quite. Okay? And interprofessional collaboration. We have a dashboard on our campaign website. If you go to campaignforaction.org, you can see that we are tracking a number, not all 43 recommendations, but the recommendations that, we think that will really count and that we can measure. And so interprofessional collaboration is one of those things that we are measuring, and what we're measuring is the schools of nursing around the country and their ability and action around bringing in interprofessional classes. So they would have classes within the School of Nursing, and they open it up to other places like social work, pharmacy, medicine. And I know Maryland is doing that as well. And in fact, they have just received, I guess it was about 6 or 9 months ago now, a grant from the Robert Wood Johnson Foundation to really accelerate and advance their interprofessional work. So Gina, are you here? So you'll be hearing from Gina a little later on. Thank you for all your work, and congratulations on the grant you are working on with our Interprofessional Center in Minnesota to further interprofessional education and practice. Diversity is really important to my foundation. Diversity and really health equity now. I know those are two very different words. We're working on, I would say, all of it. When I talk about diversity here, I'm talking about diversifying the nursing workforce. And we are making progress. We are. Of all of the health professions, this is not to let ourselves off any kind of hook at all, but we are the health professional that is making the most progress with diversity. We still don't look like the people we serve, so we have a lot of work to do, but I just wanted to throw out those two facts to you. So we gave SIP grants. Maryland was a recipient of one of our state implementation grants, and I will tell you that the foundation and the SIP grants that were given to all of the Action Coalition, they could not do anything. They could not get awarded a grant around 80-20, around leadership, around interprofessional, no matter what they wanted to do, without also including a diversity plan. So it is quite important, and we pay a great deal of attention to that. You can see that the numbers are going up for BSN grads. In 2014, which was our latest data, 30.1% up from 24.1% in 2005. I will tell you that schools of nursing all over are completely all over this diversity goal. So when I speak, I really notice it a lot in my audiences with students, a great deal of difference. So we'll be seeing much bigger jumps as we go along. And now the culture of health. So let me just tell you a little bit about how this started. My organization is a business no different than any other business in this country that is looking for a return on investment. Okay? Where all businesses are looking for, no matter whether you're Best Buy or McDonald's, what is your return on investment? And my foundation, being an evidence-based organization, we only, we convene, we like to call ourselves a grant maker secondarily. We are thought leaders, innovators, change makers. We convene, we communicate. So we do a lot of things, and we give grants when we believe we need to move the needle in a particular direction, okay? And after looking at a lot of evidence over the last number of years, you know this fact. Sometimes I have slides, I don't, but you know this fact that we spend, like, I have a graph that shows what Americans spend, what we spend, and it goes like this, right? I'm just showing what the slide says. And then the other countries are more like this, right? That's like crazy. So we spend all of this money in this country, and what do we get for our return on investment? Our indicators are much lower than all of the developing countries. That's crazy. It's crazy, right? So we look at that, And we want to move, those are indicators we're interested in, right? So we thought to ourselves, what can we do to change that in this country, to change that return on investment for us, but for all of us? And so we knew, but we decided then to act. That it's not really the doctor, the nurse practitioner. Access is important, the fancy fountains in the lobbies. It's things called social determinants. Those things like, education, how much money people make, how much school they've completed, the neighborhoods they live in, are they safe, the families that they come from. So there are things called social determinants that are much more indicative of a person's health and well-being in this country. And I love this statement. The choices that we make are only based on the choices we have. So the people that we care for in this country, so I was in an audience a couple of weeks ago, and somebody used the word, Andrew, it might have been in the winning strategy session, but I noticed somebody raised their hand and said, when my patients are non-compliant. I thought we really had gotten rid of that. I know that people can't always do what they should be doing. I just hate that word non-compliant. I'm a public health nurse, and I know that there are so many reasons why people are not able to do what might be in their best interest. But again, the choices they make are only based on the choices they have. Okay? So here are some of these social determinants that I'm talking about. Again, look at the bottom half. Education, employment, income, family and social support, air and water quality, housing and transit. These are the things that will mostly determine health and well-being in this country. So watch this. I want to show you county health ranking. Yeah, I put this in here at the last minute. So Robert Johnson Foundation supports a very, very, very large effort, very costly, investment for us. But talk about return on investment, really good return on investment with this program. County health ranking. We have invested in understanding the indicators in every single county in this country. And we can tell you, if you go to county health rankings, and you should be teaching this, how many faculty people in here? Okay, so you're all faculty. Okay, so you all need to be using this, okay? Every single one of you. It will show you, have your students look this up, right? It will show you indicator by indicator how a county is ranked. And so you can see here that, I don't know all of your counties, but Baltimore County, right, you're right down there. That's not doing as well as Montgomery County. So there are a lot of gaps in Maryland, and you can see here that if the residents of all county in Maryland had the same opportunities, if there were no gaps in this state, then I'm not going to read all these numbers to you. You can read these. And I will leave these slides here too, okay, because I know this is a lot. But you can get an idea that you have gaps in this state. You have the Chesapeake area, you have Baltimore County. So watch this.
In 2013, we spent nearly $3 trillion, which was equivalent to 18% of our GDP.
I don't know how to turn it up.
We spend more on healthcare per person than any other country in the world. Despite these costs, the U.S. is actually falling behind many other countries on a number of important health indicators, including the most important health indicator of all, life expectancy. 30 years ago, our average life expectancy ranked 15th in the world. Today, it ranks 43rd. So what's the problem? As it turns out, only a fraction of what affects our life expectancy is actually related to healthcare. Studies have shown that your zip code is more important than your genetic code when it comes to determining your health. To truly improve outcomes, we need to look beyond healthcare at a variety of factors that impact health. Things like access to housing, schools, jobs, the ability to exercise. Now, traditionally, the health and community development sectors have worked independently, but they don't have to. In fact, they really shouldn't. Let's take a look at this. Here's a map of Los Angeles County that highlights economic hardship.
It's a really tremendous video, and I would highly recommend you showing this to your students, because this video is from the Federal Reserve Bank. So you get the distinct understanding that health is an economic issue, and that these are the things that we should be investing in, right? Transportation and housing and parks and recreation. So I'm just going to go forward. So here is our new sort of vision at the foundation. We as a nation will strive together to build a culture of health, enabling all in our diverse society to lead healthy lives now and for generations to come. Okay? So, as much as Maryland is known for their interprofessional collaboration between pharmacy and nursing and social work and sometimes medicine, right? I noticed you didn't have medicine in the interprofessional grant, but a lot of schools are trying to do a much, much better job of bringing all of the health professions together. In building a culture of health, I hope you will begin to see that we need to go way, way beyond the bounds of just medicine, nursing, social work, and pharmacy and dentistry, right? If we want to really work in a space in this country where health is a shared value, which is really one of our propositions, health being a shared value, we need to be working with all of these, architects, parks and recreation, transportation, chambers of commerce, business, photographers, many, many people in this country in order to get the job done. So, why am I here? So that we don't forget the nurses. There are so many, as I mentioned earlier, there are a lot of coalitions going on, and in my foundation in particular, we are only funding things now that have to do with building a culture of health. So there's a lot that you can bring under that umbrella, and we have tons of grants programs and leadership development programs, and I will just send you to rwjf.org and its sister website, cultureofhealth.org, to really see all of the resources that are available to you and your students around how we all might build a culture of health together. But nurses have got to be front and center. And what I was mentioning before, there's so many coalitions, healthy this and healthy that, not to mention healthy people. We all know about that one. But kids coalitions and, mothers and babies, they all have to do with how we keep our society healthy and well. And we should be a part of that. So the nurse-family partnership, I think you do have nurse-family partnership in this state, don't you? So has everyone heard, well, let me just say, nurse-family partnership is an excellent example of how nurses and others, but nurses have a key and central role in building a culture of health with this particular program. It's a program where nurses become attached to a mother and father, if a father is in the picture, before a baby is born, from a lower socioeconomic status neighborhood. And the nurse really stays with that family to make sure that the family has resources, understands what a healthy pregnancy is about, eating, nutrition, staying off of drugs, and all of those things. And then the nurse stays with that family for an additional 2 years when the baby comes in to the family, making sure that they're attached to all of those resources that have to do with that infant as well. And the return on investment for this program is astronomical. My foundation has invested in, I think, over $10 million to evaluate this program, make sure the evidence is solid, and boy, is it ever. And it got written into the Affordable Care Act. And we know that there's a return on $5.70 for every dollar invested in this program spent for high-risk families. That's a wonderful example. This is another example This is a nurse affiliated with the Illinois Action Coalition. Her name is Jennifer Grenier, and she really, you know how when you're at meetings and everything, you see all that food they're going to throw away, and sometimes if I'm looking at it, sometimes I feel guilty. What's going to happen with all that food? So Jennifer and some other nurses really took it upon themselves to make sure that that food in her particular institution, I think it's a large healthcare system, got repackaged and brought together nurses and other volunteers to make sure that those meals were distributed in her community. And then, as any good nurse would, health education goes along with the meal delivery as well. So a great project to get involved in. This is the Culture of Health framework that we use at the foundation. It's a framework that is now about 2 years old, and I would say that it's more of a North Star. So if you look at this and use it, you will know that this is where we're trying to lead everybody in the country. And you can see that it's encircled by equity. So no matter what we do, we're always looking at making everything more equitable in this country. So I'm going to take you through a couple of these. I mentioned the first one already. And I should say that we worked on this with the RAND Corporation, which is one of our country's leading research firms, and so many interviews and focus groups and everything to make sure that we are, looking at the right things, measuring the right things around building a culture of health. But it is a North Star. It's not rock solid. So making health a shared value is really, really important in this country. So that's why the foundation, and we're encouraging all of the Action Coalition to expand its notion of interprofessional collaboration to all of those other organizations and people that I mentioned before. All of our leadership development programs now, they used to just be for nurses and physicians. I mean, you should see who's coming into these now. It is so diverse, not only ethnically diverse, but geographically and professionally diverse. Attorneys and business people and, transportation people and people from the faith ministry. So many people. We need all of these people to understand how important health and well-being and what the contributions are. And just in speaking of health ministries, this is an example from our New York Action Coalition, who's partnering with a Baptist church in Rochester on a health ministry, providing health education, but really with the goal of improving the health of their congregation and those involved in their congregation. So I'm really proud of this example in particular. So here's another area of the Culture of Health framework called Fostering Cross-Sector Collaboration to Improve Well-Being. Pat, did everyone get a copy of the framework? So you have that in your folder. You might want to follow along. I'm going through this very, very quickly. I can't possibly read everything in all of these 4 action areas, but I want to mention that the things in big boxes are the drivers. So if we're looking at fostering cross-sector collaboration, for example, we're going to be looking at the number and quality of partnerships, investment in cross-sector collaboration, and the policies that support collaboration. Those things underneath are what we're measuring at the foundation. And you can only measure something if something is available to measure. Okay, so you might say, well, why aren't they measuring this or that? It's because there's no standardized way of measuring that. So here's an example of the West Virginia Action Coalition, as I have encouraged all of my Action Coalitions to become more involved in the other healthy this and healthy that in their state. West Virginia has done that, and they're adding value to those coalitions as the voice of nursing on those coalitions. So here's another one, creating healthier, more equitable communities. And this is a lot about the built environment. We know that if there are walkways for the disabled, or if there are special water fountains, we know if things are built into the environment, then there's a better opportunity for health and wellness. You know this, right? And so the Tennessee Action Coalition, I love this example with a grant from HRSA. The School of Nursing there in Tennessee partnered with the School of Engineering and Architecture, and I believe Public Health, but I know Architecture and Engineering, based on many interviews. You know, I'm a former public health nurse, and I used to teach community health nursing in 2 different schools, Nebraska and Virginia. But you know how we send everybody out, the students, to do assessments, even if they're undergraduates, but masters and doctors, you know that. And they come back and they do a little project, right? So they just, this was like projects on steroids. So the School of Nursing decided to pay attention to all of those interviews. And they did massive numbers of interviews and really found that the number one thing troubling this community, Clay County, was the water, was their unsafe water. That is what was troubling them. So that's when they partnered with the School of Engineering and Architecture to build this building to not only serve as a place where you would think that why can't we have clean water just coming through the faucets? But anyways, I guess that's another issue. But to build this large structure to ensure that this would be a place to get clean water and as a place for health education and wellness. And you can just see, if you're faculty, you can see the clinical opportunities here, can't you? I think you can. And then strengthening integration of health services and system. And this is where I hone in on. I'm glad scope of practice laws are in here, but I'm glad to see that consumer experience is here, because sometimes I'll give presentations on building a culture of health, and especially if there's a student or someone in school, you know, raising their hand, or a staff nurse raise their hand. They might be in an intensive care unit or emergency room or on a med-surg unit, and they would say, what in the world does this culture of health stuff have to do with me? So they tune out, right? So I used to tell them that, hey, listen, if you just understand the social determinant, you will know, you should find out where your patient comes from and where you're sending them back to, and this should make a difference in your care and how you discharge them. You should have a social worker available. You should know what those resources are. And some of them, it would be an okay answer. And that was the answer I gave. But then you heard earlier that I did lose my husband this past October. And it was pretty grueling. It was a bicycle accident. And he lived for 10 days in an intensive care unit. And I wondered in my heart, what in the hell does this have to do with culture of health? And this was my job. And I was really upset, not only obviously with my husband and everything that was happening, but you know, where's the culture of health here, right? So then I went back to this framework, and I really looked at it, determining myself how I would ever come back and talk about community gardens and jumping jacks, you know, when that was not in my heart. So I looked at the framework, and I saw consumer experience was really important, and I began to look more into this, and I'm doing a lot of work on consumer experience now based on what happened to me and my husband. And really, you know, when we talk about well-being, it has to do with the whole continuum of care, no matter whether you're at, you know, your healthiest or end of life. This is what a culture of health is too. It means ensuring that there's well-being for that family, that they have a voice, that they participate in their care. It's not just care thrown at them. It's about nurses putting aside their computer and putting it down and looking at people and making that human connection. And that's what a culture of health and well-being means at the end of life. And so now I have a new slide, because when I was in the intensive care unit, I was horrified. I'm doing things about this. You can't be horrified with this or politics or anything without becoming involved. That's what I call you to do, not to complain or commiserate or feel badly, but we all have to be involved in making things better. So in my husband's intensive care unit, it was really about, I called them the group of intimidators going down the hall of the intensive care unit and making decisions on their stand-up computers based on lab values that day or whatever is going on, never looking at the patient, never asking the family anything. So I inserted myself in rounds and I sat there every day holding a picture of my husband so that they would understand what well-being and a culture of health meant to me and my family. And so now it is about consumer experience, and I call you to make changes in that regard as well. So how many of you have seen Hamilton in this room? So one person, and that's a very wealthy person, because it takes a lot of money to see Hamilton. But I have not seen Hamilton. Maybe one day we can all be so fortunate. But if you at least know about the lyrics, there's a song in Hamilton called "The World Was Wide Enough," and it talks about legacy. And the words go legacy. What is a legacy? It's planting seeds in a garden that you will never see. So that is what I'm calling you to do. Around the entire spectrum of building a culture of health and well-being and leadership and mentoring and bringing the next generation involved, getting your students to use county health rankings, everything that I have mentioned here for the last hour. Plant your seeds, because those seeds will go on. We're seeing the flowers blooming in Maryland as we speak, based on what they have been working on over the last several years. So let's all be involved in this legacy movement. Here is the website, campaignforaction.org. I realize I've given you a lot of links today, and I expect you to go to every single one of them. I'm just telling you. Thank you so much for having me here today.